I'm Governor John Carney. Thank you for joining us today for our weekly press conference on Delaware's response to COVID-19. Before we start, though, normally at the end of the press conference, I thank so many of the folks across our state who have helped us and are instrumental in our response, from healthcare workers to first responders and everybody in between. But I just want to start off by thanking all the essential workers who've been working under difficult circumstances and trying circumstances and frankly risky circumstances in some cases, from municipal workers in cities and towns across our state to our electrical power workers, to our first responders, EMS, fire, police, law enforcement across our state, to our healthcare workers. We've got a tremendous and have had a tremendous relationship with our hospitals and in each of the three counties. They've been doing a tremendous job. Initially, we're really shouldering the bulk of the testing for COVID-19 that was happening in our state, treating the patients the most severely ill with COVID-19, and just been a great partner all the way through. We appreciate that partnership. They're getting back to business as normal a little bit, with hospitalization rates hovering around 40, significantly below what they were just 6 months ago. Our daycare workers have been incredible as they've worked in those facilities to enable essential workers to go to work as they occupy their children during the day. In particular, I'd like to thank all the folks involved in education in our state, from early childhood through kindergarten, elementary school, secondary school, and higher ed. Each of those subgroups have been working really hard over the last 6 months as they adjusted to a new learning environment, with remote instruction being what most schools and teachers were using. Very, very new to each of them, with the challenges that technology present both in the homes and in schools. We really had to ramp up on our side, the state backbone and the school districts, to enable those connections to be made. But teachers really stepped up and are learning how to do that and do it better as we enter into the next phase. I've been saying for a long time that the hardest thing that we've had to do over the last 6 months is to reopen our schools. It was difficult to close and shutter schools and businesses and ask people to stay at home under the emergency orders. But bringing back people back to work and back into school buildings, teaching differently in a hybrid model to start, and remotely for most students, to something different than that as we get healthier, has been our biggest challenge. And so I want to thank all the educational leaders out there, principals, administrators, curriculum folks, all the teachers and staff for the work that you're doing over the summer and into the fall, and really dealing with the stress of it all. I know all the teachers care deeply about their students and want to be back in classrooms with them. But they want to be there safely. And so that's what we're trying to accomplish. I get compliments, and had some this morning. We have a weekly mayor's call that where we really get to know and understand what's happening on the ground in each of the cities and towns in our state, and business establishments that might not be following the restrictions, that might need some enforcement action, challenges that they've had with elections through the spring, and we were able to help them out significantly with that. And various issues that come up in terms of businesses that maybe aren't following the rules, as I said a minute ago. And so they're a great partner. But I did hear from one who also works with a school district in the lower part of our state, and really had compliments, Dr. Rattay, for our public health liaisons that have been working with the school districts to help them understand what are safe conditions, so teachers and parents and educators can have the level of comfort that they need, and so that instruction can occur in a safe manner. All of our objectives is to get children in schools in front of teachers, and so that's the best way for them to learn, and we're going to continue to lean into getting there. And when you think about it, there are some simple things that each of us can do to make sure that workers go back to work and our schools reopen more fully and we get athletes back on the field participating. And that is to wear a mask in public, to appropriate social distancing practices. When out in public, to sanitize and wash your hands constantly, and just be mindful and get tested and be mindful of interactions that you have with others that might present a risk. And so if we all do that, we're going to continue to push our numbers down. You'll see later when we go through the numbers as we do each week that we're flattening out even more. We're getting better. Percent positives are going down. Number of new positive cases on a daily basis are going down gradually. Hospitalizations have kind of flattened out a little bit at a very manageable level, but we want to really push them down even further. And to accomplish those objectives, each of us can have a hand in that by wearing a mask, being more vigilant, and I know often it's easy to get out of your car and forget, well, I left the mask in the car and now I got to go back and get the mask. Like all of you, I have those mind gaps as well. So with those thank yous, let's go to the data dashboard. We're up close to 17,000 cases now since the early days of March, 208,000 negative tests. Sadly, again, 603 total lives lost. That number really continues to flatten. We don't want it to see one more precious soul that is marked by that number. Unfortunately, until the virus is gone, we expect that there will be more folks that succumb to it. Hospitalizations, as I said, have leveled out right around 40. We did go down into the 30s, AJ, and I think have ticked up a little bit over the last couple of days. In terms of total cases by county, percent positive first, you see we're under 5% on that 7-day moving average, 71 new cases per day. Just to make the point about this crazy quarantine that New Jersey, New York, and Connecticut impose on us, their gating criteria for percent positive is 10%. We've consistently been below 5%. Now we're at 4.4. Their new cases per day for us is 97. You can see now in our 7-day average, we're 71. The reason we got put back on the list last week, as I indicated, is from time to time we have old cases that get entered into the system. So we have an idea of what the cumulative total is, but are dated prior to the 7-day moving average. And so when they do the calculation, they use that bigger number and therefore wrongly include us on that quarantine list. We're off again this week. We're on last week. Any kind of a criteria that works like that, to me, doesn't make any sense. It's not telling you anything about the risk in your area. So next we have the total cases, almost 8,000 cases, positive cases in Newcastle County, Kent County about 2,500, and Sussex County continues to lead, inauspiciously leading with the number of cases per population, and really need to think about that and focus on the things that we can do to prevent that. Some of it is a hangover from the poultry outbreak that we had, but we still continue to and the situation in the beach communities after the 1st of June and then after July 4th weekend. And a lot of it is that demographic, the young adult demographic that's not as careful with respect and attentive to mask wearing, social distancing, that's out in bars and restaurants, brushing up against one another too much, shouldn't be because of our current restrictions in the beach communities in particular. But this is not just a Delaware phenomenon. This is something that we're seeing, and as I've said time and again, in states across the country. And we're seeing it again in higher education. Just this week, University of North Carolina, Chapel Hill had opened off-campus parties, positive cases circulated, they closed down. University of Notre Dame in Indiana same scenario. We don't want that to happen at the University of Delaware, Delaware State University. Del Tech is opening virtually, but the concern there, and we had a good conversation on our calls with the mayors this morning with Mayor Clifton. Last night they passed stricter regulations around gatherings in the home, gatherings, parties, if you will, off-campus parties. That is where the problem is occurring in colleges and universities across the country. We don't want to see it here in Delaware. Here's the breakdown of positive cases. Again, that young adult group with the tick up there in the early part of the summer now, the highest rate of positive cases. Here's our 14-day view. Hospitalizations, again, pretty flat. Percent positives below 5% where we want them to be. We want to push that number down below 3%. Once we get below 3% on our educational opening criteria, we'll have 2 green lights and 1 yellow and be in a better position to move forward. You see the new cases per day, new positive cases per day, again, are flattening out and certainly where we want them to be relative to those quarantines from other states. If you look at the 90-day view, again, it shows you a picture of the peak or the backside of the peak and then a flattening with the increase in early summer as we started to reopen the economy and the beach crowds. And then the percent positive with the peak back in early to mid-April and the improving conditions after that. So where we are now at the end of August, we're pushing that curve down even flatter. And just to reemphasize the point, everybody can have a hand in making that happen and getting to where we want to be and getting students back in classrooms, workers back to work, athletes back on in competition by getting those numbers even better still. On our protective personal equipment, all the vessels are full. AJ, we're looking pretty good on each of those. We do anticipate as the schools reopen that we might have some challenges, I think, with the gloves you said the other day. And
yeah, so if we look at everything on there, the 2 things that are going to be the hardest really across the country and the world are going to be the N95 masks and then the gloves. We continue to have multiple orders out for them. We have already pushed out a lot of personal protective equipment with the assistance of Dr. Tay's team to the schools. So as they reopen, they should be good for that first semester of classes.
And we're anticipating the need for more of this protective equipment, both in businesses and higher ed and education. We are talking through what kind of inventory do we need to keep in the warehouse, and we'll be better prepared. Hopefully that's happening at the national level as well. And one of the areas, if you look back over the last 6 months, where at the national level and even in each state, we didn't have enough personal protective equipment in the inventory to respond to what we saw, and we expect that we're going to get that, and when the flu season comes, we're going to need more for that as well. So I mentioned school opening criteria a minute ago. Here are our current status. We're clearly in scenario number 2, the yellow scenario. If you look at new cases to get to green and new cases, we're now at 47.8. With that methodology, a CDC methodology, we need to be under 10. So we got a ways to go there. Percent positive, though, I mentioned this, we're at 4.1% on this measure. Today, I think the 7-day moving average was 4.4%. We need to get below 3 or 3%, then that'll light up the green. Average daily hospitalizations is solidly under that gating criteria, so green. So when we get to 3% or better, then we'll be in double green here for school reopening criteria. And this is going to be an ongoing process as schools reopen, most remotely, but several with hybrid systems of in-person instruction and remote instruction. We'll continue to try to work with our school districts to bring more children back online and do it safely for teachers and staff and students as well. So as I said, this is our major focus. We made a commitment weeks ago to make testing available for students, faculty, and staff. AJ's doing that. You want to report on how that's going forward and explain a little bit what it entails for the teachers and staff, a very seamless way of doing it and a good way of doing it.
No, so we partnered with Vault Medical, a company out of New Jersey, to use their at-home process to make sure we get testing kits to the faculty, staff in the school districts to line up with the time as the students were coming back as well. So it was simple. We provided the school districts with the URLs. A teacher would go on, register, get the kit, send overnight mail to them. They log on, they take the test, drop it back in the mailbox, and it gets the results in about 48 to 72 hours. So we sent out about 11,000 URLs at this time, and we will continue to do that as children are coming back into school. At the same time, under the advisement of public health, we will be testing 25% of the faculty and staff in schools a week, so we could, every teacher, faculty member, the bus drivers, the coaches will be tested, once a month ongoing as we bring children back into school. So we'll expand that program as other schools go back in person, but so far, so well.
Thanks, AJ, and really good job there. And our sense is that there's been a pretty positive response to it, and obviously, again, raising the comfort level for teacher and staff as they go back into school buildings. Face coverings for younger children, we have revised that advice, Dr. Rattay, for children in kindergarten and older. We understand, obviously, the challenge in doing that, keeping those masks on the children, but a recommendation coming out of the national CDC and other organizations. You want to comment on that at all?
Yeah, I'll spend a bit of time during my comments talking about this.
Okay, we'll come back to that.
But sure.
All right, got a little bit out of sequence there. Again, one of the focus, of course, with many of the districts that are moving into remote learning to start for several weeks is making sure that every Delaware family has the access and every Delaware student to connect, to have good connectivity with their school and school district. And so we announced this week the addition of $20 million of CARES Act funding to expand and improve our broadband infrastructure and subsidize services for low-income families. And this is mostly in the lower part of our state, in western Sussex County and western Kent County and some other regions there, less populated areas of our state. We've already started to do this there and have already extended broadband access in districts. We did hear from the pupil support personnel from the Woodbridge School District this week about how it's helped their students, and we expect that it'll help thousands of students and families going forward. So this is an important part of our reopening schools, is to improve the connectivity for students and families. We've also talking about and would remind people about the availability of relief grants for small businesses. We're using $100 million in grant money for small businesses. This is CARES Act funding as well, and eligible nonprofits. We know that many small businesses continue to struggle, particularly in the hospitality sector, and this is additional resources to help get them through this very difficult and challenging times. On the broadband, I mentioned the expansion of broadband, particularly in the lower part of our state, western Sussex and Kent counties, building on a commitment and a project that we've had going now since I was sworn in as governor 3.5 years ago. We also announced a housing assistance program using CARES Act funding, $40 million for rent and mortgage assistance to keep Delaware families in their homes, both rent and mortgage assistance. Again, CARES Act funding, some of which coming from the state allotment and some coming from Newcastle County. And then importantly, workforce development. As we bring people back to work and start to ramp up the economy again, there are lots of jobs that are in high demand and lots of folks that will be looking to improve their their employment status, and to do that they need training in certain areas and the opportunity to get certain certificates. So we've put $10 million there of CARES Act funding for that training and in-demand jobs. It's been widely known that the Congress and the President Trump have been struggling to get another relief package done. They were not able to get something approved and passed by the Congress to extend unemployment benefits beyond the end of July. And so the administration did make available an extension of $300 in assistance for those lost wages, and we are in the process of making an application for that, as many states have been doing. So lastly, before I turn it over, two things. One is to make sure that you avail yourself of testing. You'll hear from AJ in a minute that as we get healthier, as the number of positive cases goes down, our percent positive goes down, and the perception and reality is that we are getting healthier. We need to get, some people just think that it's not necessary to get tested. We do need people to continue to get tested. I went out to one of the testing sites to get tested myself yesterday to participate and to model the behavior that we're asking of each of you. So know your COVID status, particularly if you're traveling, if you have people visiting, if you're going out and you've been in circumstances, maybe if you've been in a restaurant or bar where some of that young adult population that tends to be less attentive to the guidance and restrictions, maybe you want to go out the next time you get a chance and get tested. It really, obviously, the regularity of that depends on kind of where you work, who you come in contact with, all those factors. But you should want to know what your COVID-19 status is. And then the other important thing, in addition to wearing a mask, is to wear it appropriately. I can't tell you how many people I see as I walk down the street, as I go into the YMCA, as I do to get a workout in, how many people have their mask wrapped around their neck, not even covering their nose or their mouth. More regularly, I do see people that just have the mask over their mouth and not covering their nose. And you can see from this diagram the proper way to wear a mask is to cover. In fact, maybe I should just demonstrate here. I've got my mask. Just make sure you cover your nose and your mouth and protect others from any virus that you might be carrying. So with that, Dr. Rattay, I turn it over to you.
Great. Thank you so much, Governor. And I'll jump right into that discussion around our updated guidance for face coverings for younger children. So really, the rationale for that is really multifaceted. As we have said many times, one of the, if not the most important way to prevent the spread of COVID is through face coverings. And although we had been slightly reluctant to require face coverings in younger children before, the American Academy of Pediatrics came out earlier this month with a really strong statement around face coverings for children, feeling that we had really, in many ways, underestimated the ability for kids to tolerate face coverings, and also recognizing that really there are very few children for whom there's a medical exception or exemption from wearing face coverings. So they came out with a strong statement to say that all children 2 years of age and older, including the vast majority of kids with underlying health conditions, should be wearing a face covering. And they also go to say that kids in congregate settings like childcare and schools and other places like camps where it is hard to social distance should be wearing face coverings. Now, we are not requiring face coverings for kids ages 2 to 4 at this point, but we do feel, given what we know now, that kindergarten and up makes a lot of sense. On the next slide, we talk a little, we show our trends by age. And so the bottom two lines are our youngest Delawareans. So the blue are kids ages birth to 4, and the gray is kids ages 5 to 17. And you see that there's a slight increase in infections over time. That's very different when you compare them to the young adults that the governor's been talking about, which are our top line, and adults 35 to 49, which is very close. So, the vast majority of spread and infection has been among those, that young adult population. On the next slide, we actually look at infection broken down again by age, where you can see a little bit more detail. For example, in the ages of 0 to 4, in Delaware, 249 kids in that age group have been found to be positive for COVID. If you look at that 18 to 34 age group, it's over 5,000. So there really is a huge difference in infection rates and numbers between those age groups. However, we've seen more and more in different locations where younger kids are susceptible. There was one example of a camp in Georgia where none of the kids wore face coverings. They were in a crowded setting, and a number of the kids, ages 5 to 10, did become positive for COVID in that setting. And again, that really reinforces the value of face coverings. That face coverings can really make a huge difference. Now, we know younger kids may have more mild infection, and in fact, that's great, but they also may be more likely to be asymptomatic, which again is a reason why wearing face coverings can make such a difference, because doing health screenings, we're not going to detect infection among many kids. And again, the young may be less likely to spread infection, but we don't know that with certainty yet. We don't know that they don't spread it. And one of the things that we heard from teachers when we rolled out the school guidance is they felt that kids from kindergarten and older, the younger kids, should be wearing face coverings. So with all of this together, and knowing that a number of kids are going face-to-face back to school very soon, some have already, we felt it was pertinent to really help protect all kids and all teachers in these settings. And so that is why you're seeing this change. And on the next slide, you see a kid with a face mask. And the reality is, I think everywhere we go now, we're seeing a lot of children, especially young children, comfortably and without worry, wearing face coverings. They just really are able to tolerate them with no problem. And so that is the reason for that change. I want to shift gears a little bit and talk about childhood immunizations. I presented a couple of months ago that we had concerns, certainly, about childhood immunizations, especially in April and May. So on the next slide, you can see some of what we saw. Now, the kind of brick-colored red color is 2019, and the blue is 2020. If you go to April, and also if you look at May, you see in 2020 we had a significant decrease in comparison to 2019 for childhood vaccinations in those months. But if you go to June, you see a nice rebound. Now, we're not where we need to be yet, but you can see nicely in June and July that we got some good rebound in vaccinations. Now, vaccinations obviously are extremely important in and of themselves, but they're also a really important indicator for our kids getting their well child visits. Well child visits are comprehensive health assessments and guidance visits that are critically important for kids and families of all ages. And so what we want to stress here is that we've got a great group of healthcare providers, pediatric providers in our state that are doing all the right things to keep kids safe in the healthcare setting. So it is safe to go back and get your well child visits for your kids. It is safe for them to get their vaccines now at this point. Thank you, Delawareans and pediatric providers, for helping us see this great rebound. And let's continue this trend together. I also want to touch base on management of chronic disease during COVID-19. We've had concerns that because of such significant decreases in healthcare visits, especially again during April and May, and even still in June and July, by some indicators for adults, we are seeing less healthcare visits. And on the next slide, you can see that certain chronic underlying conditions we know put people at higher risk for COVID-19. And that includes things like asthma, hypertension, obesity, diabetes, chronic kidney disease, cancer as well. And there are also some new studies that show if you control these conditions, your outcomes with COVID will be better. So the study that I am most tuned into is around asthma. For people who don't have asthma as under control as it should be, and if they get COVID, they're more likely to have consequences. But obviously there are many, many reasons why it's important for people with chronic underlying conditions to get the care they need. So again, we want to encourage people to reconnect with your physician, with your healthcare providers, if you haven't recently, and make sure you're taking care of your chronic conditions, as well as cancer screening. So this chart up there on the upper left is really concerning to us. This chart looks at breast cancer, cervical cancer, and colorectal cancer screenings. And you can see that they took a big dive in March and April, and they have not rebounded like we have seen with childhood immunizations. And that does not mean that cancer is taking a break. The cancer is still out there, but if it is not detected in early stages, then it is much more difficult to treat and control. So again, it is safe to reschedule these postponed appointments. If you are unsure about what cancer screenings you need, please contact your healthcare provider. But in general, for women over 40, should get an annual mammogram. In general, for women in their 20s should get a pap smear and an HPV test about every 3 years, and women from 30 to 65 should get pap smears every 5 years. And then colorectal cancer screenings are also very important for people over age 50. This is a critically important way to prevent cancer, identifying it early. And there are actually new stool tests that we're recommending that can be done at home. It's to be done on a yearly basis, but you can talk to your doctor about doing that at home. If it's positive, then you need to go in for a colonoscopy, but then at least you'll know that you're catching cancer early. We also have lung cancer screening for former smokers or current smokers, as well as prostate cancer screening for men over the age of 50. So again, really important that we're catching cancer early. HealthyDelaware.org has a lot of information about management of chronic diseases, cancer screenings, and for those who are uninsured or underinsured, there's great information at HealthyDelaware.org about the services that are available to you to get the screenings that you need to whether it's identify cancer or manage chronic diseases. So with that, again, I'll re-emphasize our very important messages of stay home if you're sick. Obviously, wear a face covering, especially when you're around others in public, and continue to social distance at least 6 feet apart from others. I'll hand it back to you, Governor.
Yeah, so
Thank
before
you.
we take questions from the press, I'd just like to underscore those points that you just made with respect to cancer screening. We've made tremendous progress in our state since about 2000 with the Delaware Cancer Consortium, and particularly with respect to preventive testing for breast cancer, cervical cancer, colorectal cancer in particular. We've addressed some of the racial disparities that have existed for years in each of those. So let's not lose ground there. Let's not go backwards. Let's make sure that if you're 50 years old, get your colorectal screening, different guidelines for breast cancer and those who might be susceptible to it. And the lung cancer testing is relatively new, but for kind of chronic smokers. But you could save years of your life and your life generally if you avail yourself of those protective screenings. When you talked about the mask for the younger children, it brought to mind our efforts back in the spring and more recently to come up with an approach for daycare providers to be able to stay open to address the need for essential workers. And want to thank both the providers and the workers in those daycare centers for the work that you do. And for those and all of the state agencies that are working, particularly the state budget office, for working on a way to try to make it possible for those businesses to stay open and provide that very critical service. If anybody can figure out how to keep those masks on the children, the folks that work in those centers can do it with the great work and experience that they have. So with that, why don't we open it up to the public, to the press for questions? Oh, I am really off my game today.
That's
AJ?
all right. No problem. We'll adapt and overcome. So real quick, just go over a few things on testing before we go to the questions from the press. So at the June 1st, if you think about it, we really started launching community testing in May when tests became more available, and then we procured some, started working with the National Guard in Newcastle County. So June 1st we were at 64,000. As of yesterday we were at 223,000. So a lot of work over the last few months, and still a lot of work to do. And if you break that down and we look at the 3 months individually, June we were able to get 48,000, which is great. July, if you remember, we started July with the I'll say the spike at the beach. In some of our eastern Sussex County locations. We wanted, we did not do any more sites in July. We just had a different type of outpouring of attendance from the public. So we have seen a little bit of that kind of go south in August. We're currently around 41,000 tests with 60 sites, and we have about 12, 13 more sites to do before the end of the month, and I'll talk about some of the school initiatives as well. So we'll get up to that 50, 55 range. We'll beat June, but we're not going to be at the 71,000 that we saw in July. So as the governor said a little bit ago, we have to make sure we, if you have traveled, if you've gone out, if you've had some type of encounter, make sure you take advantage of all the testing that's available across the state. Back to school testing, I just covered this a little bit earlier with the governor. We want to make sure that we have the ability to test students that show up to get tested, as well as all the faculty and staff. We will start testing at the school districts about a week to 10 days before the students go back. So tomorrow we start at Cape Penelope. We have 2 days back to back. No appointments are necessary. We'll have staff in the parking lot that helps the parents and the children register, and then they'll be kind of in groups sent into the gym where they speak with the medical providers. We'll have all the social distancing. We'll ask people to make sure they wear face coverings, and again, it's done in small groups. We do that just so that way if inclement weather comes in, we're not canceling an event like we had to do earlier in the month. This is open to communities as well, so if a parent's bringing their children that are going back to school next week, they could feel free to get tested. If somebody lives around the corner and they don't have school children, they're open to get tested as well. So we are making sure we have ample opportunities down in that part of Sussex County in the school district. We're down in Dewey today, and then have two at two of the different middle schools in the Cape Penelope School District. And BB is standing by to assist us if needed be with additional test sites, over the next few days as well. So where are we with testing? A lot's been done, and there's a lot more to do. We talked about the test for school staff, the teachers, faculty, and staff at all the schools. Sent out 11,000 links. We've used this at-home process. We've been very impressed with it. It's ease of use to register to get the kit, to get the test taken care of, and then send it back in about a 48 to 72 hour turnaround time for test results. We are looking to expand this in early to mid-September to use for individuals maybe over the age of 60 or those that don't have transportation, so they could get that test right at their house and take it quickly and turn it around. Walgreens Public Health has been working with them very closely the last few months. We've had 3 pilot stores that have been going now for some time. Going to expand that to 5 additional stores in the next few weeks, and then a few others after that. And Public Health is finalizing kind of where those stores are going to be. We're looking at the data, where are people under testing, where do we see some of the spikes, and we want to make sure they are put in those communities where we know they'll be available. As well, the nice thing about the Walgreens is they are 7 days a week, so it provides a little bit more flexibility. So as we get those around the state, it's going to be hopefully even easier for people to get tested. We've worked with the Delaware State Fire School to utilize their staff to test as well. We use the National Guard. We've had great partnerships with the county executive up here in Newcastle County using his staff, but we want to make sure that we are testing as much as we can. So we're pulling additional staff and partners in to work with. And then Dr. Pescatore from Public Health is leading the charge on antigen point of care testing. So this is a new FDA approved point of care where it's about 15 minutes to get the results, a nasal swab, and there's machines and that are portable, and you can do it right on site. And we're working to finalize a contract to get those in state, and then strategically locate them, whether it's schools, whether it's higher education. He's working on a few partners to really see how we could use that to become a force multiplier. Not only would it be faster turnaround, it'd be higher throughput and economical advantage, as well as its new technology that's coming out. So that's COVID. Last week, the governor signed Executive Order 44 for the Delaware Resiliency Fund. This is really in response to the storms that came through on August 4th and August 7th earlier this month. 2 storms devastated homes from Kent County all the way up through northwestern Newcastle County over a few days. So we are developing this program. It's been something we've talked about for a few years, and it's getting a kickstart this year thanks to the governor and our partners across the state to get us some funding for this. So going to have 2 paths that we provide opportunities for people to get assistance. First is going to be with the Milford Housing Development Group. They run the state emergency housing repair program with the Delaware State Housing Authority right now. We're going to take that, expand that to make sure it's available for individuals that had home repairs, whether it's a tree on the roof, windows broken, maybe some debris that's keeping you from going on and off your property that you're not able to move. And that's going to have qualifiers for income and how long you've lived in your house and some other application questions that they'll go through with that. And that's going to be direct support and through contractors to those individuals. The second part is how do we support our nonprofits? We have had some outstanding groups come in here. Team Rubicon, the Baptist Convention of Delaware and Maryland have been here several days, Salvation Army, American Red Cross, and I'm going to forget some of them, and I apologize about that. But, we've seen the power and the force multiplier these community groups are to assist their communities when necessary. So we want to see how we could assist those groups with whether it's, funding for equipment they might need to do a little bit more work or to get additional people in the state. So we're going to let them apply for grants as well. So we are finalizing this right now. We'll have these 2 programs out. Our goal is to have something out by the end of the business day tomorrow on our website, and we'll do a news release as well. But this is something that's hopefully going to help people recover a little bit quicker. It's not going to take care of all the trees that are down in the state. It's not going to get everybody made whole again, but it's going to be something that we could hang our hat on, to making sure we're doing what we can for the community here in Delaware, really after a really tough week that we had earlier this month. So, sir, sorry to cut you off, but back to you now.
Sorry to cut you off, AJ. Thanks for your really good work there, both on the Resilience Fund, something we've been thinking about for a couple of years. Actually had a proposal in this year's budget, which we had to take out when COVID hit and our revenues tanked. But bringing it back, one element of it is to prioritize funding in the Department of Transportation's budget for road resurfacing for problems that were created by the storm events. I've seen many of those in districts across our state, and we'll have to be looking at getting additional resources for that when the General Assembly comes back in our next budget cycle. But this partnership with the nonprofits, with Milford Housing and the others, is a really important way to fill some of the gaps that we've discovered, starting with the big tornado that hit outside of Laurel back in 2018, and then of course the storms we saw in a week span here in central Delaware and lower Newcastle County and western Newcastle County. So thanks for your work on that, AJ. And with that, now we're ready for questions from the press who's joined us today. Meredith, thanks for being with us again.
Hello. With the state approaching the 6-month mark for the pandemic, can you all say how many poultry workers have been infected and died from the virus at this point in time?
I don't know that we can say that. I can tell you that I look, and I'll turn it over to Dr. Rattay, that with respect to the poultry workers, and let's talk about it from 10,000 feet, from the perspective of looking on my community, my healthy community. There's a high percentage of those who tested positive that are classified as Latino. We know that a significant percentage of those workers are Latino. But if you take it to those that die, actually the number or the rate of death for those individuals on the website is not as high as its percentage in the population. So whether there's any conclusion that you can draw for that, may be an age-related thing. If you look at those deaths, again, vast majority of them are in the 65 and older category. And so how many Latino, Haitian workers, Caucasians that are working in those plants that are over 65, my guess is not a big number, right? So do we have the exact number? I think the answer is no, but I think we can characterize the effect by what we see on My Healthy Community on the website.
Yeah, and it is a question that we ask in our contact tracing work. So, in our case investigation work, which we have been doing all along. Well, we didn't add the question until we started to see the outbreaks. And of course, no doubt many poultry workers who were infected were probably never identified as positive cases. But we should be able to have an estimate of the number of confirmed cases and deaths. I don't have it at the top of my head, but I can circle back with the team, Meredith, and see if we can get that. I will tell you, and I asked probably about 10 days ago or so I don't think it has changed. We have not seen a positive case among poultry workers for probably a couple of months. So it has been a while since we have seen any positive cases.
And what obligation do these poultry plants have to the state in terms of reporting numbers and, the state checking in that they're following, social distancing guidelines and so forth?
Yeah, so really from the beginning, since we saw the first case, we were working in partnership with the poultry industry in our state and visiting and providing technical assistance and support as it relates to, infections control measures. And so, those discussions have continued. The partnership has continued. As far as it's not a mandate for them to report cases to us, where the best way for us to really get the information for any employment setting is the questions we ask during case investigation.
And with nursing homes and hospitals, Governor, have you made a decision about whether they will be immune to lawsuits related to the coronavirus?
I have not. We've not entertained that question for some time. My focus initially was on the hospital side of it, not so much the nursing home side of it. I don't know that I got the direct request there. I am looking at the website to your question, and this was part of my answer, of the deaths, the total deaths by race and ethnicity, Hispanic/Latino, 44 out of 600 and so. And if you compare that to the number of cases, which you could easily do, you'd see. And so you have to, query why. But if you go back and you look by age, 500 or thereabouts are 65 and older. So it's very much with respect to, that, the fatality rate is very, very much, corresponds with age and, of course, pre-existing condition, which does raise the slide that was presented today, and any individual with those conditions, some of which are fairly prevalent in terms of obesity and diabetes and asthma, really need to think about and be extra vigilant about protective face masking and social distancing.
And I just wanted to ask about the census. Governor, do you have any concerns about where Delaware is with its census and the accuracy issues, if at all? From my understanding, Delaware is currently below the national average, and I think Sussex is just a little bit over 50% completion. Do you have any concerns just with the deadline approaching?
I do, and I think we ought to extend the deadline. I have delegated the responsibility or asked the lieutenant governor for help with respect to that, and it's been an all hands on deck kind of thing. But as you say, the returns aren't what we'd like it to be, and so we ought to extend it. We're doing a census constitutionally required in just an unprecedented time of a pandemic, which I think calls for special considerations to make sure that every person is counted. Just like in the election, we want every vote to be counted, which is why we went to the extent of passing a vote by mail law just for this primary and general election.
Okay, thank you.
Thank you, Meredith.
All right, first question is from Nick Ciolino at Delaware Public Media. With coronavirus metrics remaining largely flat for some weeks, are you noticing any dip in the number of people getting tested?
Yeah, I think AJ can answer that. I mean, it was part of his presentation. They're definitely down a little bit.
No, so we'll see, from the highest in the 70s to, probably around 50. So we're going to see about 20,000 testing decrease for the month of August. At the same time, we had some severe weather that played a role and really wiped out several nights and a few days of testing. At the same time, we haven't had any of that, emotional type news that has made the front page like we had back in June and July to really get people to, show up in a little faster fashion. So, any message that we have from, our media colleagues to help, put that know your COVID status message out there is important. We are not turning people away. So, we're doing about 20 sites a week across the state and looking to expand that so that the testing options are out there for individuals.
From Tom Lehman at WBOC, the CDC has changed its position on 14-day travel quarantines and no longer recommends it. Have you had any communication with governors in New Jersey and New York about Delaware's on and off position on both of their lists?
Yeah, I guess you could call it communications. I've had some shouting matches with my friend Governor Murphy. Frankly, the problem is that we're reporting the data to be as complete as possible. And in doing so, they're not being very attentive to the methodology that they're using and the numbers they're taking. If they took our numbers in daily positive cases, you would see it was 72 today, I want to say, on the 7-day moving average. The cutoff for their measure is 97. Why are they saying that we're above that? Because they're including all these cases that were subsequently put in the database and show up on our cumulative total, but the tests were a month ago or 2 weeks ago or 3 weeks ago, certainly out of that interval. But they don't care enough to take the time to even respond to us and tell us how what kind of methodology they're using. We would tell them the methodology you're using is flawed, and therefore you're coming up with a calculation that completely misrepresents the number of new positive cases on a 7-day moving average. The right number we showed everybody about 30 minutes ago, and it's significantly below that. So now for the CDC to say that quarantines don't make sense, we shouldn't be on the list in the first instance. And they certainly don't make sense, makes no sense if you're on 1 week and off the next, and on the next week and off the next. I mean, it's not even a 14-day interval. Not that I want a 14-day interval for something that doesn't make any sense, but they should do away with it and or at least change their methodology of calculating the gating criteria.
Next question's from Amy Cherry at WDEL. What do you think of stricter limits on gatherings like what's being imposed in Newark?
Yeah, I think the Newark restrictions make a lot of sense because they're based on what we've seen across the country, which is off-campus parties that get out of control. Alcohol's involved, more than 20 people. You can imagine the number of students. Look, I was in college too. We would have had parties like that as well, and kind of made it a joke of it. It's not funny, and it really is putting people at risk. So somehow, and I don't know, certainly, how old am I? 64-year-old telling a college student what they should or shouldn't do is probably not the way to get the message across. But putting a restriction like that and enforcing it, I think, will make a difference. I think it'll prevent the spread of the virus more broadly in the community, ultimately maybe save lives, and certainly affect the restaurateurs there in Newark who have been all over us about allowing them to have more people in their establishments. Well, if we have a lot of COVID-19 infection in that community and people aren't taking the restrictions seriously, we can't, it wouldn't be right to allow them to safely, they would not be able to safely open with more people inside. And so it just makes sense. Mayor Clifton, I think, has been doing an excellent job in trying to manage what's a very challenging situation. We've already seen the examples in University of North Carolina, Chapel Hill, University of Notre Dame, where they opened the campuses, off-campus parties, started an outbreak, had to close them down. Just think about the inconvenience, the cost, everything involved in that kind of a situation. We don't want that here in Newark at the University of Delaware, Delaware State, in Dover.
Next question's from Sean Green at WDEL. Fall youth sports leagues are beginning to form in the wake of DIAA's decision to suspend fall sports. Can DPH give an update on its efforts to create guidance for football and wrestling?
Yeah, before I turn it over to Dr. Rattay, I wonder, and I asked friends that I know are involved on football, which I know a fair amount about, and I don't know how you do it safely. I've said it in our press conferences here. I don't know how you do the line play safely when these guys are, a foot or two apart, banging heads against each other on every play. Wrestling, I don't know as much about it, but it looks like they're awful close and entangled with one another for an extended period of time. Again, I'm not sure how you do that, but with that as the layman's view of it, Dr. Rattay, tell us what the public health science is on it.
Yeah, so obviously we're huge advocates for youth sports. From a public health perspective, we see tremendous benefits, social, emotional, mental health, and physical health benefits of youth activities, youth sports, and frankly, a lot of kids have been sitting around inside the house and haven't been moving their bodies as much as they need in the last 6 months. So, we do see youth sports as very important. Non-compliance with some of the youth sports activities that have gone on out there has been a problem, and it is something that we're working to tighten up. So we are working on new sports guidance in general. It is a work in progress, so I am not prepared to provide a lot of details at this point, but we are looking at what are options for some of the high contact sports like wrestling and football. And so that is, again, a work in progress. More to come soon.
All right, so the last question's from Matt Biddle at Delaware State News. Governor Tom Wolf recently tweeted he was calling on the state legislature to legalize recreational marijuana, with the revenue going to small business grant funding and restorative justice programs. Has COVID changed your mind on marijuana legalization as a means to bring in funds at all?
So folks might remember that a couple years ago, we had a proposed constitutional amendment to change the way that Delaware does its budgeting and to target our operating budget to a certain couple metrics that have to do with the growth in the economy and income and population, and to come up with a target growth rate established by the Delaware Economic and Financial Advisory Committee. It also called for additional resources above that amount to go into a reserve fund. The legislature didn't approve the constitutional amendment, but by executive order, I said the administration would follow it. And we did, and we were lucky that we did. It was probably the smartest thing that I've done as governor, and that is because we had established, in addition to the 5% rainy day fund, which is between $250 and $300 million, we set aside another $125 million or so in a reserve fund. And then when this year happened and our revenues went south, we had additional cushion to be able to address some of the budgetary needs referenced in the question with Governor Wolf. We also used, as we showed today, additional CARES Act funding for both small business assistance as well as to help with various training needs for workers. And so my own view is that we have sources for those kinds of programs, and that it doesn't make sense to approve something that I think is not healthy for folks, to fund something that is a result of a chronic disease in our state of pandemic. So with that as the last question, again, I want to thank Dr. Rattay and her team at the Division of Public Health for all their great work. I want to thank A.J. Shaw for his work as the point person in our testing efforts, and all our law enforcement and first responders in the fire service and communities across our state, all the essential workers that we thanked at the top who've been working day in and day out over the last 6 months, as many of us were in our homes being protected from the COVID-19 virus, and they were in frontline positions, often exposed on a daily basis to the virus. I'm convinced that we're going to get better as we move into the fall. We're closing out August next week. Schools are opening in Delaware and across the country, sometimes remotely, sometimes in person, but we're going to get healthier. We're going to get to that 3% green light stage, and we're going to continue to move children back into classrooms, and we're going to do it safely and protect all the great teachers and educators who are doing that work out there, preparing and ready to go remotely, and then as we bring folks back to work and back into classrooms. So thanks for your attendance, your attention today, and we look forward to seeing you next time.